Hands up if you have neck pain. Well, you're not alone. With a lot of our lives focused around screens, sometimes the muscles and fascia and joints get tight and restricted around the neck. So let's do something about it. Welcome back to TSC Connect. I'm Physio Andrea, a Schroth-Certified Physiotherapist and the founder of the ScoliClinic in Vancouver, Canada. So this is a special routine because it's a guided self-massage session, not one of our typical workouts. We're starting from the chest and working our way up through the neck and into the face and the head. There's a lot of connective tissue or fascia that runs through all of these areas to connect them. So even if you have tension in, say, one area of your neck, it can be effective to work on decreasing tightness in nearby areas, such as your shoulder or your jaw. Find a comfortable seat in a chair or on the floor. Make sure your hands are clean because you'll be touching your face at some points. And if you have neck pain, try this every day for 1 week to see if it helps relieve tension. If it doesn't, of course, please seek a scoliosis-trained physiotherapist. Let us know what you think in the comments below. And if you like this and you want more, click the join button on our channel page or go to the link in the description to join our membership where you'll get monthly videos made by me exclusively for our members. Thanks and enjoy this neck massage to relieve some tension. So we're starting our massage from the bottom up. So we're starting at our chest area because a lot of these muscles and the fascia are all connected to the neck. So let's start by releasing some tension in the chest muscles. Starting with the pectoralis muscles, I like to take my hand and just try and grab. Essentially, it's like putting your fingers in your armpit and grabbing onto the bulk of the muscle that's here. And so it doesn't have to be anything really you don't have to be too hard, but it's just, if you're just picking up the muscle a little bit, keeping this arm rested, you just want to do little circles, and sometimes you can even just do like squeezes of the pec muscles because then that helps to decrease some of the tension there. Let's do this for 30 seconds on this side, and then we're going to switch and do 30 seconds on the other side. Try and stay seated, nice and elongated and supported through the spine, and make sure to remember to breathe the whole time. Ready, set, go. Sides in 3, 2, 1. Switching sides, 30 seconds on this side. Ready, set, go. Next, we're working on the subclavius muscles, which are the muscles that are just underneath your clavicle or your collarbone. So for this, I like to take my knuckles and just find your collarbone here and just work on this little space just below. I'm placing my knuckles just below my collarbone, and I'm doing circular motions starting from my sternum and kind of slowly moving outwards. You don't have to press very hard because your ribs are here, so it might feel a little bit pokey, but it's just a very gentle massage. Start from the middle and work your way outward, and keep doing that for 30 seconds, and then we're going to switch to the other side. Ready, set, go. Switch sides in 3, 2, 1. Switch sides, so placing your knuckles, finding your collarbone, and just going below your collarbone from the middle to the outside. Ready, set, go. Next, we're going to massage our shoulders because our shoulders also connect all into the neck fascia. And so there's a couple ways you can do this. Sometimes I like to take my whole hand and think about like picking up my deltoid, which is this main shoulder muscle here. And it's almost like I'm picking it up and gently pulling it away from the shoulder. And then I just kind of like move it around like that. Or you can also take your knuckles again and also massage the front. So your choice, you can mix around the techniques and play with them. Sometimes you can cross your arm across your body so that you can get a little bit easier access to your shoulders. And do this for 30 seconds on one side, and then we're gonna switch sides. Ready, set, go. Sides in 3, 2, 1. Ready, and go. Our upper fibers of our trapezius are connected from our shoulders all the way up into our skull and are often the culprits of some tension or pain. So we're going to do a gentle fascial release. Taking your whole hand, you're cupping your hand and using your palm and your wide fingers, so not pokey fingers, but wide ones, and place on the meaty part of your shoulder. And essentially same thing, I'm thinking about grabbing the whole muscle and kind of picking it up away from the body, just to break up some of that tightness and just to get everything moving around there. So I'm moving back and forth along the body of that muscle for 30 seconds on this side, and then we'll switch sides and do it for 30 seconds on the other side. Ready, set, go. Switch sides in 3, 2, 1. Switch sides. Ready, and go. So we're going to do that same pinching technique for our back of our neck. So we have erector spinae, they're called, are the muscles that run along the sides of the spine. And so sometimes those get really tight too. And so I'm going to place my hand behind my neck and I'm going to do a gentle pinch and pull away from my spine. Again, not using pointy fingers because that can feel quite irritating. Trying to make your fingers as flat and as broad as possible and think more of like a gentle picking up motion, okay? We're gonna do this for 30 seconds, just one time. Use whichever hand you want. Sometimes you can switch hands because it might feel a little bit different, but let's get going. 3, 2, 1, go. Okay, so we've massaged our pecs and our deltoids and our trapezius and around that area. So let's do some shoulder circles to kind of just move everything around now that it's not as tight. So I'm just gonna pretend that you have pencils on the ends of your elbows. You're doing big circles with your elbows because that helps to bring your shoulders in a really big movement too. And we're just doing this for 30 seconds. Try and go as low as you can, as forward as you can, as high as you can, and as back as you can. So really making big circles to really open up those shoulders. Okay, ready, set, go. Okay, now we're moving into our neck. So there's a really important muscle on either side of our neck called the sternocleidomastoid, SCM for short. But it essentially attaches from your neck, your collarbone, up into your head and right behind your jaw, and actually to your jaw. And so sometimes that can get really tight. And so what we're gonna do is take your fingers, you might have to play with like your actual hand position, but essentially what you're trying to do, so you can see if I tense my head, that's the muscle right there. So we're trying to gently, very gently, pick it up or try and like basically pull it forward or try and massage around that area. So you can see how I'm trying to essentially pick up the muscle a little bit and just massage. If you can't find it and if it's too sore or painful or like too pokey, just think about like basically doing gentle squeezing of the muscle all the way up towards the back of your ear and then back down. So just keep it super simple. Do whatever you can, 30 seconds on this side, and then we're switching to the other side for 30 seconds. Ready, set, go. Sides in 3, 2, 1. Good, switch sides. Ready, and go. Another muscle group that can really contribute to tension in the neck and maybe even headaches are the masseter muscles or your chewing muscles. So what we're going to do for this one is make little fists again and kind of use not the really pointy part of your knuckles, but the flatter side. And we're just going to place them on the sides of your jaw and do very gentle circles. Try and keep your teeth apart and your jaw relaxed and just do gentle circles. You can kind of move up and down. It's basically in between your cheekbone and your actual jawbone. And the muscle kind of runs this way. So you can just move wherever in there. But the most important thing is to keep your mouth relaxed so that you can really try and massage that muscle. Okay, do this gently for 30 seconds. Ready, set, go. Another major muscle that contributes to chewing as well and is really like connected to your head and your jaw is the temporalis muscle. And so if you place your hands on the sides of your temples and you just clench your jaw, you can feel there's a little bulge that happens there, and that's the temporalis muscle. Now it runs all the way up towards your head. And so what we're going to do, same thing, is find that's the flat part of your knuckles, starting just above your cheekbone. We're doing gentle circles with a little bit of pressure. You don't want to do anything too hard, but you're essentially moving all the way up into your hairline as well, okay? So we're just trying to go across from your cheekbones, up into your temples, and behind into your hairline, just kind of moving upwards. Keep your jaw relaxed as well, and we're doing this for 30 seconds. Ready, set, go. Okay, so next is side flexion and some rotation. So we've done some manual massage of the face and the neck. Now we're going to do some active mobility. So bring your ear towards one shoulder. So you're stretching this side of your trapezius, keeping the tension on your muscle gently. Then think about bringing your nose down towards the floor and then slowly rotating it up towards the ceiling. So the whole time I'm keeping the angle of my neck down to the side, but I'm adding elements of rotation. Move slowly through rotation for 30 seconds on this side, and then we're going to switch to the other side. Try and keep your shoulders as level as you can. That's something I struggle with. Ready, set, go. Sides in 3, 2, 1. Switch sides, bringing the other ear towards the shoulder, trying to keep your shoulders as level as possible, and then adding that rotation. Ready, set, go. Next, we're moving into some gentle neck extension, okay? So it's really important that we have to do a controlled movement here. What we're trying to do is stretch the front of our neck and also do some range of motion for those spinal joints. So what you think about doing is keeping a lot of space in between your head and your shoulders. From here, you're just gently reaching your face up towards the ceiling so that your chin, you're creating lots of space between your chin and your chest. However, do not collapse backwards, because for me, that's really easy. My head can like rest on the back of my neck if I'm not really supporting my spine. So I'm really trying to think about keeping lots of space behind my neck, and I'm just lifting my face up towards the ceiling, and I can feel that stretch all down the front of my neck, so your platysma. So really looking up and then coming back towards center, okay? Try to keep your back neutral as well, so you don't want to arch like that. So stay as neutral as you can. We're moving up and down gently, controlled for 30 seconds. Ready, set, go. really important tip from a caring physiotherapist. This is something that we say to a lot of our patients, is that if you're going to do massage or any sort of release, it's really important to add some stability back into your system, because sometimes if you're just stretching and not doing any sort of like muscle activation, you can feel a little bit like wobbly and almost like unsupported. And so we're going to activate some of the muscles around the neck that we were just massaging and stretching, okay? So what you're gonna do is place your hand on your forehead, and so from the side view, and then without moving your head, I'm just going to think about tucking my chin and pushing my forehead into my fingers. I'm holding that for 5 seconds, and what that does is it activates a lot of the muscles on the front of my neck. And then after 5 seconds, I'm switching that hand to the back of my head, around my ponytail, and then I'm going to push my head back into my hand. And so I'm activating a lot of the back muscles of my neck. So we're just gonna do that a few times. We'll walk through it together. So we'll do 5 seconds front and then 5 seconds back, and we're gonna switch back and forth a few times, okay? Ready, here we go. Pressing into your hand to activate the front for 5, 4, 3, 2, 1. And now switching and placing a hand in the back of your head and thinking about pushing your head into your hand for 5, 4, 3, 2, 1. Let's do that again. So front of the head, push, 5, 4, 3, 2, 1. And back of the head, push again for 5, 4, 3. You might want 2 hands, 2, 1. Let's do that one more time. You try 2 hands this time. Both hands on the front of your forehead, push for 5, 4, 3, 2, 1. Both hands on the back of your head, push your head into your hands for 5, 4, 3, 2, 1, and rest. Our last exercise is doing that muscle activation gently for the sides of our necks. So taking your palm and placing it against the side of your head, it's the exact same thing. 5 seconds push into this side, then we're gonna switch 5 seconds, and we're gonna do that whole round 3 times. Here we go. So placing the side of your head, pushing into your hand for 5, 4, 3, really activating through this side of the neck, 1, and rest, switching hands, pushing into my hand, activating this side of the neck, hold for 5, push, 4, just gently, 3, 2, 1, and rest. 2 more times, okay? One hand, start with your original hand, push for 5, 4, 3, 2, 1, switch sides, push for 5, 4, 3, 2, 1. This is our last round. Start with your original hand, gently pushing for 5, 4, 3, 2, 1. And the last one, push into the opposite direction to activate those neck muscles. 5, 4, 3, 2, 1, and rest.
We hope you find this information helpful. For more how-to videos and scoliosis-friendly workouts, check us out on TSC Connect. See you next time.